Did you know that by the time you feel a toothache, your visit to the dentist is already overdue? But to be honest, I don't blame you, because a lot of people miss the actual early signs of when they should be paying their dentist a visit. And in the 17 years of experience owning and running my practice, Dougherty Cosmetic Dentistry here in San Antonio, I've seen countless patients ignore these early and maybe even not so early red flags, so they end up needing more complex treatment and more costly treatments later. Now, most people think they only need to see a dentist when something hurts, but honestly, pain is usually the last sign. It's literally your body telling you, go to the dentist now. So in this video, I'll share the 5 signs that mean it's really time to see a dentist, and how spotting them and paying attention to them can save you time and honestly, money. Bleeding gums when you brush or floss. But first, let me tell you this. When was the last time you really looked at your gums after brushing? If your gums bleed when you brush or floss, that's not normal. It's usually a warning sign. I can't tell you how many patients come in and say, oh, my gums always bleed when I floss. That's just how they are. Or that their gums are too sensitive. But the truth is, healthy gums don't just bleed by themselves, because usually that's an early sign of gum inflammation or gingivitis. Think about it this way. If your hands bled every time you washed them, you'd be concerned, right? Your gums should be just as resilient. When you see bleeding, redness, or puffiness, that's your body's way of telling you there's a problem that needs attention. So don't ignore it. The good news is, caught early, gum inflammation is completely reversible. But if you let it progress, it can turn into periodontal disease, which can lead to tooth loss and has even been linked to heart disease and diabetes complications. So here's what you need to do to keep your gums healthy. First, keep track of when your gums bleed. Does it only happen with flossing or even when brushing lightly? This information helps your dentist understand how advanced the inflammation might be. Second, avoid brushing harder. Many people think, believe it or not, bleeding gums mean you need to scrub more, but that actually makes things worse. Instead, switch to a soft bristle brush and use gentle circular motions. Third, book a cleaning and checkup before it progresses into something more serious. Professional cleaning removes the bacteria and tartar that your toothbrush can't reach. But bleeding gums aren't the only sign your mouth is trying to warn you about something. Sometimes the problem isn't what you see, it's what you smell. If you're starting to realize these early signs could be warning you of bigger problems, then the smartest move is to catch them before they turn into painful, costly treatments. The only way to know for sure what's really happening is to get checked out by a professional. If you're in the San Antonio area, book a consultation with us today using the link in the description. Don't wait till it hurts. Get clarity and peace of mind now. Struggling with bad breath. Now, we've all had morning breath, but if it sticks around all day, that's something else entirely. It's kind of like smelling smoke in a room after you've burnt your food. If it lingers long after the fire's out, it means something's still burning, and you just don't know it. That's kind of the same thing with our teeth. Persistent bad breath is often a sign of bacteria buildup, cavities, or gum infection, not just poor hygiene. You see, when bacteria accumulate in your mouth, whether it's from food stuck between your teeth, gum pockets, or even cavities you can't see, they produce sulfur compounds. These compounds are what create that persistent, unpleasant odor that doesn't go away with mints or mouthwash. Many people try to mask bad breath with gum, mints, or strong mouthwash. But if the underlying cause isn't addressed, you're just covering up a problem that's getting worse. I've had patients who were avoiding close conversations or covering their mouths when they spoke because they were embarrassed about their breath. In most cases, the solution was treating the underlying dental issue, not just better hygiene. So here's what you need to do to address the problem. Track whether your bad breath improves after brushing, flossing, or rinsing. If it comes back quickly, that usually means there's a source of bacteria that your regular routine isn't reaching. Make a note if people comment on it, or if you notice it lingers throughout the day, even after eating or drinking. And honestly, you should share this information with your dentist. It helps them pinpoint whether it's gum-related, cavity-related, or something else entirely. Sometimes, bad breath can even indicate issues beyond your mouth, like sinus problems or acid reflux. But bad breath isn't the only warning sign you should pay attention to. Noticing white spots, stains, or discoloration. It's also about what you can actually see when you look in the mirror. Imagine seeing those little white spots. You figure they're just cosmetic, so you try whitening strips from the store. But instead of making things better, the spots look more noticeable now. So you decide to visit the dentist, and you learn that those white spots weren't stains at all. They were signs of early enamel weakening. This is exactly why understanding what different types of discoloration mean is so important. The mistake most people make is trying to bleach these spots away with whitening kits, which can actually make the problem more noticeable. When you bleach healthy enamel, it gets whiter, but when you bleach weakened enamel, the contrast becomes more obvious. Knowing whether discoloration is a surface stain or an early warning sign can mean the difference between a quick fix and major dental work later. Yellow or brown stains along the gum line are often tartar buildup that need professional removal. Dark spots on chewing surfaces could be cavities starting to form. And those chalky white spots, they're often the very first sign of tooth decay before a cavity even forms. So, how do you deal with it? Check your teeth under good lighting and note any new spots or changes. Take photos if you need to track changes over time. Avoid at-home whitening kits until you know the cause. You might be masking important warning signs or making the problem worse. Bring up any discoloration with your dentist. They can tell you whether it's something that needs treatment or if it's just a cosmetic staining that can be safely whitened. Intense sensitivity to hot or cold. Discoloration is often tied to enamel damage, and the same enamel loss can also make your teeth feel painfully sensitive to hot or cold. Tooth sensitivity often signals enamel erosion, cavities, or even gum recession, exposing the roots. It's like stepping outside on a freezing day with an old winter jacket. At first, you're fine, but eventually the cold cuts straight through, and after an hour of walking outside, you're shivering to the bones. That's what happens when enamel wears down. Without its protection, even hot or cold food feels extreme. Your tooth enamel is the hardest substance in your body, but it's not indestructible. When it wears away from acid, grinding, or just normal use over time, the softer layer underneath, called dentin, becomes exposed. Dentin has tiny tubes that lead directly to the nerve of your tooth. So when something hot or cold touches exposed dentin, it's like sending a direct signal to the nerve. That's why sensitivity can be so sharp and sudden. Tooth sensitivity can be an early warning sign of cavities forming, gum recession exposing the root, or even microscopic cracks in the tooth. If left untreated, these small triggers can progress into infections or the need for a root canal therapy. In other words, sensitivity is your tooth's alarm system. If you catch it early, you can avoid far more invasive and expensive treatments down the road. I've seen patients ignore sensitivity for months, thinking it would just go away. But by the time they came in, what could have been treated with a simple filling had progressed into needing a crown or even a root canal. Here's what you should do. Book a checkup to find the underlying cause before it worsens. Sometimes sensitivity can be resolved with a simple desensitizing treatment, but sometimes it indicates a bigger problem that needs attention. Switch to a sensitivity toothpaste while you wait for your appointment. These contain compounds that can help block those pain signals temporarily. Point 5. Experiencing jaw pain, headaches, or tension. And while sensitivity is uncomfortable, sometimes the warning signs show up beyond your teeth. For instance, you wake up every morning with a dull headache or sore jaw. But since it's been happening to you for so long, you just shrug it off, thinking it's just stress. Bruxism is a common condition, but it's more complicated than most people think. It's not always just about the teeth. Often stress, airway issues, or jaw misalignment are involved too. The teeth get damaged, yes, but that's usually the symptom rather than the root cause. If left unchecked, constant clenching and grinding tear down enamel, make teeth shorter and more sensitive, and put heavy stain on the jaw joints and muscles. So how do you know if bruxism might be an issue for you? Notice if your jaw feels sore in the morning or if you hear clicking or popping when you chew. These are signs your jaw joints are under stress. Keep track of how often headaches occur and whether they worsen after sleep. Morning headaches that improve throughout the day often point to nighttime grinding. Ask your dentist not only about night guards, but also about TMJ evaluations or other factors that could be contributing. Sometimes protecting the teeth is just one part of addressing the bigger issue. Your dentist can also spot signs of grinding you might miss, like worn spots on your teeth or enlarged jaw muscles. But here's the thing, if you or your dentist has spotted any of these signs, what's the next move gonna look like? You'd be surprised to find out it might come down to just two options, composite or porcelain veneers. That's because these two are the most common ways to rebuild both function and appearance. But how do you choose between the two? Well, that's exactly what I break down in the next video. You can click here to watch.